Okay, we ready?
Ready.
And we are recording and recording. Just wanna double check. Hi, I'm Debbie. I'm gonna be the nurse practitioner taking care of you today. I'm gonna sit down here with my blank notes. And just have a little chat with you. What's your name?
Samantha,
Samantha. What do you do for a living, Samantha?
physical therapist assistant.
Okay. And how old are you?
39.
39 years old. And what are we seeing you for today?
I have a sore throat.
Sore throat?
Mhm.
Tell me about your sore throat. When did it start?
About 2 days ago. Very scratchy. Sore when I swallow. Just mostly on one side.
Mostly on one side, on that left side?
Left side.
Have you taken anything at home for that?
Normally I'm an ibuprofen kind of girl.
Normally an ibuprofen? Have you taken any ibuprofen?
Just once today.
Once today? Okay. And then what number would you say your pain is on a scale of 0 to 10?
When I swallow, it's probably about 6.
Okay. And when you take the ibuprofen, how does that pain go down?
For a little while.
For a little while? And what does that pain go down to?
Probably about 3.
About a 3?
Mhm.
6, 10, down to 3 or 10. And what time did you take the ibuprofen?
About 3 hours ago. Afternoonish.
Anything that seems to make it worse or better?
Cold helps.
Cold helps, like drinking cold?
Mm-hmm.
And you said it hurts when you swallow.
It just numbs it up some.
Any other symptoms that go along with it, like a runny nose, ear pain,
Yeah.
sore throat, cough? When you said sore throat, cough, anything like that
No
goes
cough.
along with it? Okay. Any fevers?
Not that I'm aware of. I have not checked, but I haven't felt any chills or anything that usually accompany those.
Okay, so no fever, no chills. Perfect. What I'd like to do today, we're going to talk about your sore throat, but I would like to do a complete assessment and ask you about your past medical problems, about a little bit, get to know you a little bit more, and then do a complete assessment on you. Is that okay with you?
Yes, that's fine.
Are you comfortable enough?
Yes.
Okay, perfect. Are you warm enough?
Yes.
Okay, at any point in time you're not warm enough, you're not comfortable, please let me know. We can adjust the heat, we can get you a blanket, anything you need. Okay, perfect. So let's start off a little bit with past medical history. Do you have any past medical history yourself, like diabetes, high blood pressure?
No, nothing like that. I've had 2 babies.
Two babies.
Then I had surgery once for a ovarian cyst that started hemorrhaging.
Oh.
That was 8 years ago.
Okay. And did you lose your ovary?
I did
when
not.
they did?
Mm-mm.
Yeah. Okay. And 2 babies, 2 pregnancies, 2 babies?
3 pregnancies, 2 babies.
3. Did you have a miscarriage once?
Between the 2.
Between the 2?
Mhm.
Perfect. How old are your kids?
14 and 10.
14 and 10. Those are fun ages, right? Boys or girls?
Girl and boy.
Girl and boy. Oh, girls. I'm telling you. Teenage girls. And then, do you take any medications on a daily basis?
I do not.
No meds?
Mm-mm.
Do you take any kind of supplements, anything like that?
Nope.
Okay.
Coffee.
Coffee. Coffee's a supplement of champions. And you had 2 babies. Do you have normal menstrual cycles?
They are regular now.
Regular now?
Yes. Growing up, they were not, but after babies, they are.
Okay. Do you take any, what do you use for birth control?
I don't.
No birth control?
No. No, husband got a vasectomy.
That was going to be one of my next questions on down the line here. Are you married? Are you, so married, husband had a vasectomy, so no birth control for you?
Yes.
Okay, perfect. I'm guessing you're in a monogamous relationship.
Yes.
Yeah, that would look bad if you came.
That would be interesting. Hard to explain.
Hard to explain. Are you allergic to any medications?
Not that I'm aware of.
Okay. Any allergies to any foods?
Not that I'm aware of.
No foods. How about pets allergies or environmental allergies?
There's one little weed flower that it's fluffy, and I will break out in hives.
A weed flower fluffy.
Yeah, they come in like purple or white, and that is the only thing I've ever seen in my life. Ooh, that's not right. You know, like the cinnamon gum, like the big red gum. My tongue will swell and break out on the sides.
Cinnamon gum.
Since I was 15.
That's interesting.
It
Okay.
didn't. That started in my whole family. that year.
Oh,
It was
so
very weird, very strange.
no cinnamon gum for you.
No cinnamon gum for me.
And then how about latex allergies?
No.
No latex allergies? Excellent. Do you mind we talk a little bit about your family and your family history?
Parents?
We're gonna go deep. Let's start with mom.
My mom has had 2 heart attacks. She's also got diabetes, which she's not on medication for anymore. So she's brought all of that down. So it was more of a pre-diabetic kind of thing.
Okay.
Dad, no.
Tell me about one, but
Oh.
before you continue, I have a question about mom. How old was mom when she had her heart attacks?
First one, 53.
53.
Second one, almost a year to the day after.
So 53 and 54. That's
They
pretty-
said that the second one was because of damage caused by the first one.
Okay, now we can talk about your dad.
Nothing.
Dad is healthy.
Gallbladder, it's gone.
Gallbladder. Do either of them take medications on a daily basis then? Mom still takes medicines since she's had some cardiac disease?
She does cardiac, not for diabetes anymore.
Okay. Okay, mom's parents, grandma, grandpa.
Don't know grandpa.
Okay.
Grandma had, I think it was uterine cancer. Was it uterine cancer? It was some lady part cancer.
Mm-hmm.
Lupus. Oh, that's my mom also and her sister.
Your mom and your mom's sister both have lupus
Yes.
also?
And she has diabetes, my grandmother.
Your grandmother.
Mhm.
Is your
No
grandmother
cardiac stuff.
Is your grandmother still alive?
Yes.
Okay. And do you know how old your grandma was?
85.
85. 85. And you said your mom's dad, did he die?
He died.
before
He
you?
died. Complications from a car accident.
Okay, so he died from a
Epileptic complications from a car accident.
okay.
Yes.
So related to a car accident. Okay, and then how about your dad's mom?
Brain cancer.
Brain cancer?
Died.
How
I
old?
was 15. God, she had to have been late 50s, possibly 58, maybe. She was young. Yes.
And then how about dad's dad?
Died in January of Parkinson's. He also had quadruple bypass.
Was he
Diabetes.
young when he had heart disease?
He had that after my grandmother had passed.
So in his 50s into his 60s?
Yeah.
Okay. How about brothers and sisters? Do you have any brothers and sisters?
I do have brothers and sisters.
What you got?
2 sisters, older and younger.
2 sisters, older and younger. Are your older and younger sisters healthy?
Yes.
Do they have any major medical problems?
My older sister had preeclampsia with one of her babies, and
Okay.
nothing came from that. And
Now you're 42. How old was
I'm 39.
Oh, what did I say?
My older sister is 40, and my little sister is 38.
Oh, nice
Yes.
little. Your mom is busy.
Triplets. Yeah.
Yeah, pretty much. Okay, a little bit more about your social history. We talked. You are married. Any financial concerns or problems with your family that you're concerned about not being able to afford things, anything like that? Affording health care, not a problem for you or your family? Okay.
Through our jobs.
Excellent. And then how about religious concerns? Do you have any religious things that affect your health care or you'd like for me to be respectful of for your care? And then as far as cigarette smoke?
I grew up with both my parents smoking. I don't smoke.
Secondhand smoke exposure
Yes.
as a young person.
Yes.
Do you vape?
Nope.
Alcohol? Occasionally, never?
Very rarely.
Rarely?
Occasionally, yeah.
Um,
I'm like maybe once a week, maybe.
once a week?
Yeah.
And then if you drink something once a week, how much do you drink in that setting?
Like a glass of something. A
Wine,
beer,
like
a glass of wine, a drink.
Perfect. No drug use, illicit
Nope.
drug use, no marijuana, anything like that.
Nope.
I think that's personal history, social history. I think that's kind of it as far as my questions. Oh, I did forget to ask you. Do you have annual pap smears done still?
I think the last one's about 3 years ago.
I And have you ever had a mammogram?
I have had a mammogram. That was maybe 5 years ago.
5 years ago?
Mhm.
And dental. Do you go to the dentist regularly?
Yes, regularly.
When was your last dentist appointment?
August.
Okay. And then as far as eye doctor.
I have not been in some time.
Okay. Long time. And then have you ever had a colonoscopy?
No.
What about immunizations? Are you up to date on all your immunizations?
Yes.
And did you get a flu shot yet this year?
Not yet this year.
Okay. Got one last year?
Yes.
And then have you gotten your COVID vaccinations?
Yes.
Excellent. All your vaccinations, family history, okay. We're going to go a little bit more into your review of systems. How would you consider your general overall health?
Healthy.
Healthy?
Could stand to lose a little weight, but other than that, but most of us can't.
Exercise regularly?
Yes.
Okay.
On the days that I don't work.
Okay. How would you say your diet is?
I don't deny myself stuff, but I don't overeat or overindulge like on sweets and things.
Okay.
I balance.
I think that's a good plan. Any problems with your nails, your skin, any lesions, lumps, bumps, anything that I should be aware of?
No.
Any problems with hair loss, excessive hair growth, anything like that?
Had hair loss due to school stress a couple of years back. Went to a doctor, had some injections, all the hair's back now.
Excellent.
That is the only time I've ever had that happen.
Okay. Interesting. How about any problems? Let's just talk about ear, nose, throat, that kind of stuff. Any previous problems? You've got a sore throat today. Has this been an ongoing come and go thing for you, or is this like kind of an isolated event?
Isolated.
Okay. Any problems with ears, ear drainage, any pain or burning with your ears, any ringing in your ears, vision problems?
Nope.
No problem seeing far, seeing in the dark, seeing anything like that?
Nope.
Well, not all the way dark, but
right.
And then any problems with like nasal drainage, postnasal drip, anything like that?
I had a scan once that they kind of looked at me and said, "We're not really sure how you breathe out of your nose because they said polyps or something."
Okay.
And but I don't have any problems breathing.
Okay. Well, we'll look at those here. No problems with your neck, no problems with stiffness, movement, anything like that?
No.
Respiratory wise, any cough, shortness of breath, anything like that?
No.
Do you ever have trouble when you're laying down flat at night breathing?
No.
Any problems where you feel like you have palpitations of your heart, anything like that? How about your cardiovascular wise? Any swelling in your feet or ankles that you've noticed?
If I run a lot, I'll have a buildup of lactic acid in my calves. That is about what I've got.
Okay.
It hurts.
Hurts?
But that's it. Yeah.
Your legs hurt when you run a lot?
It's real hard.
Benefits.
Massage it out. Yep.
Benefits of running. Yeah. Any no other shortness of breath, nothing like that. Okay. Belly wise, any nausea, vomiting, diarrhea, hemorrhoids, blood in your stools, anything like that?
Nothing like that.
Heartburn.
Only if I have spicy food too late.
Spicy food too late, gives you heartburn. Got it. Spicy. We'll say no to that. How about musculoskeletal? Any joint pain, knees, ankles, elbows, wrists?
No.
Okay.
No.
Any problems with your back?
No.
Any muscular weakness? Who knows? Okay.
Nothing.
Any pain in your kidney area, your flank area?
Nope.
Pain or burning with urination?
Nope.
Any problems with that you've experienced previously or currently that you're worried about STDs?
Nope.
Okay. How about breast exams? Do you do monthly breast exams?
I do my own at home
Okay.
breast exams. Yes, I make sure that that's
Okay.
fine. Since the mammogram.
Since the mammogram.
Yep.
Any problems with lumps or bumps? Anything that you found? Any lymph nodes swollen? Anything like that? Any problems with like chafing around your nipples or drainage? Anything like that?
Nothing like that.
Have you noticed any other areas where you're having swollen lymph nodes in your groin, anything like that we need to worry about?
Nope.
Any problems with bruising?
No.
Don't bruise easily. How about your gums? Any gum bleeding, anything like that?
No. Not
No?
since I started flossing regularly.
Oh, good. Flossing regularly is good. And then, have you ever had like a significant head injury where you lost consciousness?
Apparently when I was 3, I did have a concussion.
Concussion at 3. No, nothing since then.
Nope.
Any problems since then with memory loss? Any problems with like dizziness or like
I started getting migraines at 9.
migraines at 9?
Yep.
How often do you get those?
They used to be super regular, and I had babies, and they became a lot less regular. But I also get them couple times a month, maybe.
Okay. Do they come with your periods?
No, I find it when I'm excessively tired.
Excessively tired.
Yeah.
I get that. Okay, and then any problems with like your mental health that you want to discuss? Any problems with depression or anxiety or anything like that?
No.
Have you ever tried to hurt yourself in the past? No. Do you have any thoughts of harming yourself?
No.
And do you have any thoughts of harming anyone else?
No.
Okay. So mental health is not a problem for you at this point in time?
No.
Generally happy?
Generally happy.
You look generally happy. Okay. Okay, I think that kind of ends that part of our assessment. If you're good, I'm gonna wash my hands and we're gonna just take a better peek here and take a look at all of you.
Sounds fun.
Okay. I'm just gonna set this off to the side. We don't need this anymore. And then, okay. This bed looks up. Is it up a little bit? No.
Just a high bed.
I wanna come around here and make sure this is still recording.
The little green
I
light.
think so. Okay, perfect. Okay, little green light. Okay, we're just gonna start off at the very top. I am
Do you need
assess-
to-
Nope, you're
Okay.
good right where you're at right now.
Okay.
This is Samantha. I'm assessing Samantha. She is sitting upright. She's awake. She's alert. She looks well. She's smiling. Her appearance seems nice. And upright, no posture issues, anything like that. Generally, she looks like she's not having any distress. Would you agree with that?
Yes.
No distress.
No distress.
Okay. What we're going to start off first, we're going to take a look at your hands first. We're going to go from there, okay?
Okay.
So I'm going to just look at your nail beds, breast cap refill. She's got no clubbing. You're warm. You're really warm. You actually warm. Her skin is dry.
Pretty sure they said hyperhidrosis or something when I was a kid.
Yeah.
All my sisters and I.
A little bit
Sweat.
sweaty palms.
We
Okay.
always sweat.
She's got 2+ radial pulses. Those feel good. I'm just gonna feel up your arms here. Any pain, anything? Okay. I don't see anything on your arms that I'm concerned about. No lesions, anything like that. If I were to see a lesion on any part of your body during this assessment, we would get our handy dandy magnifying glass, and we would also get out our ruler. We would measure those, take photos if we needed to. We would make sure that we note the color, the consistency, if there's a change of color, the size, is it raised, is it flat, what is the pattern, distribution pattern of any lesions that we would find, if there was any drainage, anything like that, or if there was any odor, we would notice that, all of those things as we were doing, okay?
Okay.
So I don't see anything like that on your arms. I'm just going to go ahead, since we're here, I'm going to go ahead and feel your pulses here. She's got 2+ brachial pulses. And I'm just going to assess whose epitracheal nodes. Nothing noted there. Axillary nodes, no, you don't. Nothing noted there. Any pain through any of these joints? Nope, nope, okay. We're just going to do a little bit of range of motion. So we're just going to kind of range of motion with your hands here, fingers, good, wrists, and then elbows, everything good. And then we're just going to go up with your arms. Any pain with range of motion with your shoulders? Okay. I'm going to just go ahead and test your strength. So go ahead and squeeze my hands. Excellent. No, you are strong. You are strong. Okay, go ahead and just push down and then pull up. Excellent. And go ahead and bend your elbows, push against me, and pull back. Excellent. And then those elbows up. Hold me up. Good. She's got great strength. You're very strong. I didn't realize how strong you were, Samantha. So super strong arms bilaterally here. I'm gonna just do a couple other kind of little funky tests here.
Yep.
I'm gonna have you just kind of hands here, rapid hand movement. No problems with that. Very good. And then we're gonna just check some coordination things. So I'm gonna have you touch my finger, touch your nose, touch my finger again.
Oh, this hand.
Yep. And then we're just gonna do it with this one. Touch my finger, touch your nose, touch my finger again. Very good. I'm gonna have you close your eyes for me real quick here. Next thing we're gonna do is something called close your eyes. Check for stereognosis. So hold out this hand for me. What is that? Can you tell me what's in that hand?
Paperclip.
Paperclip it is. Okay. Now we're gonna put something in the other hand.
Pen.
Ink pen. Very good. You can open your eyes. You passed the test. We're gonna go ahead next and check your reflexes here in your arms. So we're just gonna check this reflex here and your patellar reflex. Excellent. And then break. Very good. And then right here, your radial brachial. Very good. We're gonna do that again on both arms. And then try and do this where the camera can see. Relax that arm as much as you can. There you go. Very good. Very good. Very good. Excellent. We will check your reflexes again when we get to your lower extremities, but we're going to finish up at the top first, okay?
Okay.
So arms, everything looks good on there. I'm not concerned about anything. Now we're going to go to your hair and head.
Okay.
Are you fine with me touching your face?
Yes, absolutely.
Okay. I'm going to go ahead and touch my alcohol up here a little bit before I touch your face. Okay. I'm just going to look at your hair and your head.
It's gray or white.
You do have a little bit of gray coming in there at the very edge. There's no hair loss. The hair is very clean. It looks like she has some, you dye that a little bit, which is very culturally normal because that's what we do. Nothing abnormal on her hair at all, or any concern. I'm going to go ahead and palpate your sinuses here, your frontal sinuses and maxillary sinuses. Any pain anywhere I touch there?
No.
Okay. We're going to go ahead. Nothing there?
Mm-mm.
Okay. On the inspection of that, everything on your face looks very symmetrical. I don't see anything that I'm concerned about as far as your skin color, temperature, condition, cyanosis, anything like that. So after we're done palpating your face there, we're going to go ahead and I'm going to take a better look at your eyes, okay?
Okay.
So as far as with your eyes, what I see right away is like you have even distribution of your eyelashes. You have very good eyelashes, very good eyebrows. Her sclera are nice and pink. There's no redness to her conjunctiva. Her irises are very pretty brown. I can just see your pupils pretty easily from there. I'm just going to do a couple examinations of your eyes, okay? Okay. First thing I'm going to do is going to shine this light. You just kind of look over my shoulder there. I'm going to shine this light and we're just actually kind of like right here on my shoulder. Okay. And we're just looking here at the Hirschbergs and I'm just looking to see if that light reflects evenly off both eyes, and it sure does. So that's a normal exam. Next thing we're going to do is we're going to check for consensual and direct accommodation. So just look straight ahead at that sign right there. We're going to do, you got positive direct, and you've got great accommodate or consensual response on this side. And we're going to go ahead and do the same thing with the other eye. You've got direct response and consensual response. Very good. Those are all good normal testing. Next thing we're going to do, I'm just going to have you watch the end of this right here. And we're just checking for accommodation, and that is very good and fine. We're going to check your fields of vision. So I'm going to have you just look up here, 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 here. Very good. Last thing we're going to kind of do there with your eyes on the external eye exam is we're going to do the cover uncover test. So I'm going to cover up one eye, and you're just going to keep looking at me. Perfect. And we're looking to make sure that your eyes don't wander or stray from where they're supposed to be, and they don't. And no nystagmus, anything like that noted. Okay, we're going to do the fundoscopic exam of your eyes. Just take a peek at those. Just gonna get real close to you here. I'm just gonna look in your eye. And I see a positive red reflex. I see the optic nerve and all of the vessels and our veins and arteries in your eyes all look fine. No tortuosities, no hemorrhages, anything like that. No swelling. We're just gonna look in this one. Same. I got a positive red reflex, and no, I see the optic disc. There's no hemorrhages, nothing that I see in your eyes. Okay. Perfect. Okay. Done with your eyes. We're gonna move on to your ears. First thing I'm going to kind of do is just take a look. Everything looks nice and symmetrical. She does have some earrings that are very pretty earrings in both ears. I would double check to make sure there's no exudate, anything like that, any drainage, anything I'm concerned about those ears. There's not any pain when I pull here on your tragus? No. Cool. There's no drainage, anything that I'm noticing from the external ears either. All right. We're going to kind of go to the internal ear exam. First things first, I'm going to look in this ear. And your ears are nice and clean. Those TMs are pearly gray. I'm able to visualize the bony structures behind the ears. There's no bulging, there's no drainage, anything from your tympanic membranes or ear canals. We'll look in this one. Again, nice, pretty ears. Those tympanic membranes look clear. There's no bulging. I can see the bony prominences in there. Nice, pearly gray. Next thing, what we're going to do with your hearing is I'm going to do a little bit of hearing evaluation. Okay, so I'm going to have you cover up this ear. Okay, and I'm going to say 3 letters, and I want you to tell me what they are.
RBC.
Perfect, and then we'll go around to the other side.
Flip.
Yep, flip.
MCK.
Perfect. While we're thinking about this and our hearing, I want to check your long-term, short-term memory as we go along here. So I'm going to give you 3 words right now. At the end of this exam, I'm going to ask you those 3 same words
Quiz.
again. It's a quiz. It's an easy quiz.
Okay.
3 words for you to remember are brick, football, and boat.
Brick, football, boat.
You got it.
Okay.
And then can you also tell me who the last 2 presidents were?
Trump and Biden.
Excellent. So I wanted to remember to give you those 3 words. What we're going to do now is we're going to test for your bone conductivity and your hearing. What I'm going to do first, I'm going to hit this. It's going to sit kind of on your forehead. You're going to feel it. I want you to just tell me if you feel the vibration evenly through all of your. Okay?
Okay.
Maybe.
Yes.
Very interesting, isn't it? Okay. Now what we're going to do is I'm going to tap this again. I'm going to set it behind your ear. I want you to tell me how long until you can't hear it anymore or can't feel it anymore.
Okay.
And then we're going to turn it, and I want you to tell me how long until you can't hear it anymore. Okay?
I can't feel it anymore. I can't hear anymore.
Okay, that's really good.
That's
Even
really
a little bit more than 2 to 1 for your bone conduction, ear conduction, so that's good. I'm going to do this side.
I can't feel it anymore. I can't hear it anymore.
Okay, perfect.
So long.
I know, perfect. Okay, next thing we're gonna look at is your nose. So,
I'm sorry if there's anything in there.
no, you're good.
The nose ring.
You do have a nose ring. So she's got a nose ring. The nose is symmetrical. Doesn't look like she's ever had any damage to that. Nice little cute nose ring on the right side. There's no drainage, anything like that I'm concerned about. I want you to just check. Breathe in and out. No difficulty through either narrowing.
Nope.
Perfect. And I'm just going to look on the inside of your nose, okay?
Interestingly enough, it's not the damage. I've been hit in the face with every ball that I ever played sports with.
Oh, you're a big sports girl?
Yes.
So her terminates are actually pretty red and there's a lot of swelling in there. I know, chronic swelling?
Crying.
A little bit of swelling in that terminate there too as well. Alright. Next thing I'm gonna do, wash my hands one more time. We're gonna check out your mouth and lips, okay?
Got it. I don't have all my teeth.
You don't?
I don't. I never had,
I don't have all my teeth either. I've had a lot removed.
I had 3 removed. 2 molars and 1 wisdom tooth because that's all I had. The molars were on the top. They grew too long because I didn't have molars on the bottom to push up
Did you have that
against
done when
them.
you were a teenager?
Huh?
When you were a teenager?
Mm-mm. I was an adult.
Oh.
Yeah, because the teeth were just longer than the others.
I just gonna kind of look at your lips first. Lips are nice and pink and moist. We're gonna kind of look at your gum line and all that kind of stuff. I want you to puff out your cheeks. And now, give me a frown. I can't frown very well. I'm just checking cranial nerve number 7 there. That's intact. Now we're gonna check cranial nerve number 12. I'm gonna have you go on it. Just kind of lay your tongue there in your mouth and then kind of stick that tongue all the way out. Nice and strong tongue. Put it on side to side on each of your jaw lines. Other side, very good. All that's intact. I'm just gonna put my finger in here and check all your gum line. Missing, like you said, a couple of teeth in the back there. Everything else looks good. That soft palate and hard palate is intact. Go ahead and give me a big ah. That uvula is nice and midline. Slight, I can see those tonsils, maybe a 1+ tonsils, a little bit of swelling there. Sore throat. Ain't no lie.
Oh, one of these is a cap. I forgot.
One's a cap.
Yeah, that one.
Before I get too much further into looking at all the rest of your neck and stuff, I want to listen to your temporal arteries, and I want to feel your temporal arteries in. Okay, so we're going to just feel right here. Excellent. I'm going to feel your carotids. Excellent. And then I'm just going to listen here. Okay. No bruises noted anywhere there. Just gonna go ahead and check your skin turn here on your chest. That looks good. And we're gonna check all of your nodes. So I'm going to kind of check here your preauricular nodes, postauricular nodes, occipital nodes, tonsillar nodes, submandible nodes, submental nodes, supraclavicular nodes, superficial. I said supraclavicular. Let's try that again. This is your anterior cervical. This would be your superficial, your posterior cervical. I think we already did the occipital. We're going to go ahead and shrug your shoulders a little bit. Supraclavicular, subclavicular, nothing noted there. Excellent. Good skin turn all the way around. I think before we get behind you, and I'm going to go ahead and evaluate from the back and check your thyroid gland. It's a great time for me to go over my exam table and just make sure I'm checking everything, okay?
Mm-hmm.
I think this is the time that we said we were going to do a quick check. Okay, before we get turning around, I'm gonna have you open your jaw for me. And we're just gonna check for TMJ. Perfect, I don't feel any clicking in there. And we're gonna do some range of motion of your neck. Can you go down, down, this way, back up? Any pain with range of motion? Okay, and then just go ahead and push against my hand. Excellent, push again. Nice, good strength there. Okay, I'm gonna have you go ahead and swallow for me. No problems noted swallowing. Just gonna come around to the back here and we're gonna feel, go ahead and swallow. Checking that thyroid, everything feels great there. Okay, we're gonna go ahead into the back here to your posterior. First, I'm gonna kind of inspect your posterior, looking for any heaves, retractions, accessory muscle uses, anything that's abnormal. I'm gonna look at your skin color, condition, temperature, if we didn't have your shirt on here, and just kind of go through all of that stuff, making sure that we're looking. And then we're going to, I'm gonna put my hands on here, just checking for equal expansion. Perfect. I'm gonna check something called Frembris. So go ahead and tactile firmitus, go ahead and say 99.
99.
Again.
99.
Again.
99.
Good. Don't feel any idea of consolidation, anything like that. Next thing we're gonna do is we're gonna check for something called esophagy. So go ahead and say the letter E.
E. E. E. E. E. E.
Perfect. The E doesn't turn to an A. That's what we want. Okay, I'm just gonna listen to your lung sounds here. Nice breaths. Lung sounds are clear. I'm going to listen to 3 sides laterally on the right. Two on the left. And those are also clear. I'm going to just check for some CVA tenderness here. Any pain with palpation?
Nope.
Okay, and we're just going to do a little bit of percussion. Perfect, everything looked good on the back. Okay, we're gonna move right around to the front here, and I'm just gonna take a look at the front. We already checked your skin turgor. Your skin is not cyanotic. I don't see any muscle, accessory muscle use, anything like that. No retractions, no increased work of breathing. I'm gonna just go ahead and feel your chest. No lumps and bumps, anything noted there. Okay, and then we're just gonna go ahead and percuss here. Can. Excellent. And then we're just going to listen to your lungs here in the front. Big deep breath. Good. One more time. Good. One more time. Good. And again. Good. Lung sounds are clear. Respiratory rate is about 16. I'm going to throw those gloves away. What I'd like for you to do now is lay down flat for me, if you don't mind.
Feet there?
Feet there. Yep. Oh, no. You
That way.
on your back. Yep, you're good.
Okay.
Okay. I'm just kind of looking, examining from the right side. I don't see any kind of JVD. Belly's nice and flat. Go ahead and lift your head up there for me. Good. Her facial expressions don't show that she's having any discomfort with that. I don't see any heaves and masses, anything like that on her belly when she lifts her head. I'm going to go ahead and put my hand here and check, just palpate your precordium. That feels normal. And then we're going to go ahead and I'm just going to do some listening, okay?
Okay.
We're going to listen over several places here. And I'm going to listen first with the diaphragm, and then I'm going to flip and we're going to listen with the bell, okay? So we're going to go to the second intercostal space to the right sternal border for your aortic valve. Excellent. We're going to go second intercostal space on the left sternal border for your pulmonic valve. Excellent. And we're going to go with third intercostal space, left sternal border for your orbs. Excellent. And then fourth sternal border. Sorry, trying to get right in here, Biz. And we're going to be listening for that tricuspid area. And then we'll just go right down here. This is mid-clavicular, fifth intercostal space to list for this mitral. And this is the maximum point of impulse, so we would listen and check your apical pulse here. I want to compare it to your radial pulse as well. And those are nice and even. Rate is about 70, and it's very regular. If it were irregular, we would listen for a full minute. And I'm just going to flip this, and we're going to listen with it all the way back up, okay? Okay. Excellent. While we've got this out, I'm going to go ahead and listen to your femoral arteries too, okay? Okay. We're going to fill your femoral arteries. 2 plus femorals. No Broes noted. We're just going to feel those inguinal nodes. Nothing noted there. I'm going to go ahead and check for pretibial edema. There's none noted. And we're going to go ahead and check your posterior tibial and pedal pulses. Pedal pulses are 2 plus. Posterior tibial also 2 plus. Okay, we're going to do the next part of this examination with you lying down. What I'm going to do is kind of check all of your range of motion of your lower extremities. Then we're going to do some strength testing, and then we're going to do some testing of a couple movements of your lower extremities to check your knees. We're going to be checking for your ACL and meniscals and make sure that everything's okay there. Okay? So let's start at the very beginning. Can we get to the very beginning? Getting to your legs here. I'm just trying to make sure that we can see legs. Yep. Okay. So we're just checking your feet here first. Those nice toes are nice and clean. She's got 1 manicured toe there. That's the story of my life these days. Everything looks good though. Feet are nice and warm. Can you go ahead and just bend your feet up and down? Excellent. And then I'm just going to have you bend at the knees. Kind of bend that up and down. Bring that back down. Bend up and down. Great. And we're just going to have you lift that leg straight up in the air. Perfect.
Like,
whatever you want.
How far?
Any pain with any of those movements?
No.
Okay. So a good active range of motion. We're going to just go ahead and do some strength testing. Go ahead and push against. Pull up. Excellent. No pain here in your ankles. Nothing when I palpate there. Okay. Just going to palpate on up here. Any pain in that knee while we're palpating? Okay. Go ahead and push. Pull down like this way. Great. Push up. Excellent. We're going to palpate over to this knee. Any pain in that knee when I palpate?
Mm-mm.
Okay, go ahead and push away. Pull down. Excellent. I'm just going to come up here to both of your legs. Nothing that I see there. Okay. Go ahead and push your leg all the way up. Good. Down. Good. Up. And down. Great strength. Now we're going to do a couple of different things to check some of your strength here. So I'm going to start there. We'll just start with this one first. Let's check your anterior and posterior drawer. So I'm just going to kind of pull here. There's no instability noted. We're just going to finish your whole right leg before you do your left leg. We're going to go ahead and do this Lockman's test. And there's no laxity, anything like that noted in that. We're going to go ahead and check the McMurray's test, and we're just going to bring that in, make that little nice M. Excellent. And we'll do the Epley's grind. And then, there we go. No pain with any of those.
Mm-mm.
Excellent. We'll continue on to this side. Just check this anterior drawer. Good. No pain there?
Nope.
Okay. Go ahead and check this Lockman. I'm just going to push against here. Push against here. No pain? Okay. We're gonna make that nice little M again. Excellent. No pain with any of that?
Nope.
Okay, and then up please. No pain?
Nope.
No pain when I do distraction. Perfect. I am going to ask you, I know that you do not have your socks and shoes on, and I do not want you to walk on this floor with no socks and shoes on, so I'm gonna give you your shoes before I ask you to check your gait.
Oh.
Because we don't wanna walk on this floor with no shoes on.
That's dangerous.
It can be dangerous.
Okay. What am I doing?
Okay, I'm just gonna actually ask you to stand up, take a few steps forward. Just want to heel the toe, just kind of want to watch your walk there.
Oh, you want to see it?
Yep. And then go ahead, heel the toe, perfect. And then I want you to go ahead and just walk on your tippy toes. Excellent. And then can you walk backwards by walking on your heels? Excellent. Okay, I'm gonna next have you hold both arms out there, just like that. Close your eyes. We're just kind of checking your balance. Romberg test is they're very, very good. No problems with that. Can you do a deep knee squat for me? Any pain with that?
Yep.
Okay, perfect. We're kind of missing you on the
Oh,
camera
sorry.
doing this. Nope, it's not your fault. The bed's not quite long enough. So you were able to do that with no problems.
Yes.
Okay. What I would like to do is now is kind of check the range of motion of your back.
Okay.
So you kind of bend over for me, kind of touch your toes. Any pain with that? Anything like that?
Nope.
Okay. Now I'm going to kind of turn you towards me just for the camera's sake.
Okay.
So that everybody can see what we're doing. Go ahead and bend over, and I'm just checking to make sure that everything looks even. Those iliac crests, the scapulas, gluteal folds are all even, and they are. There's no humps, bumps, anything like that that I can see anywhere on you. And I think that's most of our exam. Now, can you tell me those 3 words?
Brick, football, but
Very good, very good. And then before we end, I'm gonna do one more check of my notes to make sure that we did not forget anything, since we can have a second eyeball here. I did not ask you to shrug your shoulders for me. Shrug your shoulders. Excellent. Shoulder strength is very good. Everything else I think is okay. I don't think we missed anything major. Except for the one thing that I miss every time. We're gonna just have you sit down on the end of the bed there for me. One more thing. Every time, forget those darn reflexes. So let's go ahead, we're just gonna check that Achilles reflex. And then, or this is your patellar and this is your Achilles reflex. Very good. Patellar and Achilles. Perfect. I think that concludes our exam. I appreciate all of your time today. I really appreciate you hanging out with me. So,
thank you.
what else did you have to do at 5 o'clock in the morning? So,
Nothing.
nothing at all. Thank you. Now we're gonna end the video.